Abdelsattar. She will be telling us about the imaging of vasculitis in pediatric rheumatology.
I'd like to welcome Professor Dr. Hotamoon, Professor of Neurology, Pediatric Neurology, and Professor Dr. Dalia Helmi, Professor of Pediatric Immunology, and dear colleagues, Dr. Hadil Saif and Dr. Rania Hashim from Cairo University, and thank my colleagues in Ain Shams University Radiology Department. I will talk about imaging of vasculitis in pediatric rheumatology. My objectives are to define systemic vasculitis and to recognize different types of vasculitis according to the updated Chapel Hill Consensus Conference criteria for systemic vasculitis 2012, and to review the imaging pathway of systemic vasculitis. The term vasculitis refers to changes occurring in the vessel wall induced by inflammation. Classification started in 1993, where Chapel Hill Consensus Conference categorized vasculitis according to the predominant site. And then in 2006, the European League Against Rheumatology and the Pediatric Rheumatology European Society adopted the classification system. And then by 2012, revised Chapel Hill Consensus Conference a nomenclature for vasculitis. Vasculitis can be categorized either primary, mostly autoimmune diseases, or secondary, occur in association with or because of other diseases or drugs. Vasculitis can be small vessel vasculitis, medium-sized vasculitis, or large vessel vasculitis. Diagnosis of vasculitis depends on a multidisciplinary approach, starting from clinical criteria, laboratory markers, imaging features, and pathology. The role of imaging either to evaluate the vessel itself in large or medium-sized vasculitis, or to assess the end organ disease in small to medium-sized vessels. First, to evaluate the vessel in large or medium-sized vessels, this 7-year-old girl with large vessel vasculitis, we can see here abdominal ultrasound showing the aorta here, thickening of the circumferential mural thickening involving the aorta. And here a focus of calcification. On CT angiography, again, is a thickening of the ascending and descending aorta with multiple areas of dilatation and narrowing, in this case involving whole the aorta from the aortic arch downward. Also 3D showing the involvement of the proximal main branches of the aorta. This is chiassoarthritis, where there is a primary granulomatous vasculitis affecting the aorta with its major branches. What about MRI? MRI shows inflammation of the wall. We can see here the thickening of the wall with exhibiting hyperintense signal on a stir-weighted image, and this can differentiate between stenosis caused by fibrosis or circumferential thickening due to inflammation. Also, the whole body MR angiography or CT angiography offers a panoramic view of large vessels and their branches, allowing detection of early disease changes. However, MRI may overestimate the degree of stenosis with possible misdiagnosis of vessel occlusion. Another case of 5-year-old girl presented with oral and genital ulcers and hypertension. Abdominal ultrasound again revealing the irregularity of the wall of the aorta with the thickening here, as we can see. Also, the case post kidneys shows a small size of the right kidney, and there is a damped waveform. Also, the left kidney shows the tardive bulbous pattern of its renal artery waveform, and this is a diagnostic of renal artery stenosis. CT angiography shows here the narrowing and the regularity of the right renal artery, also the left renal artery, and the narrowing of the circumferential thickening of the aorta with narrowing of the lumen. And this is the 3D reformat. We can see here irregularity and narrowing of the lumen of the abdominal aorta. Also, the celiac vessel here was involved. This is a case of Behçet disease associated with large and medium-sized vasculitis. On imaging, there is a large and medium-sized vasculitis in a pattern similar to chiassoarthritis. However, the case should be interpreted in the proper clinical context. And so the Behçet disease was the final diagnosis. Imaging modalities employed in the assessment of large vessel vasculitis, as we saw, ultrasound, CT, and MRI. And so what about PET-CT? We can see here FDG glucose uptake here in the ascending and the descending thoracic aorta, and this is a coronal PET showing uptake in the whole aorta. While the role of PET-CT in diagnosis large vessel vasculitis is established, its role in evaluating disease activity is less clear-cut. PET may be used as an ancillary technique, but a comprehensive assessment including clinical, laboratory, and morphological changes is still required to monitor patients with large vessel vasculitis over time. Another case of 1-year-old boy with clinically suspected Kawasaki disease. We can see here aneurysmal dilatation of the coronary with areas of narrowing. Also similar case of Kawasaki disease, another aneurysmal dilatation of lead branch. Kawasaki disease is the second most common childhood vasculitis. Coronary artery involvement is a typical disease feature. This is typical. Other large-sized vessels may be affected with stenotic segments and aneurysms. Again, arthritis. Another case of polyarthritis nodosa, we can see here transmural and necrotizing inflammation of medium-sized arteries. We can see areas of beading of the vessels with areas of narrowing alternating with areas of dilatation. Another case of 4-year-old boy with history of recurrent DVT presented with congested chest wall and neck veins. We can see here the multiple vessels here and 3D reformat, multiple congestion of the vessels with absence of the superior vena cava on the right side. It was thrombosed. The patients unfortunately developed acute onset of right lower limb pain and was found to have on Doppler thrombosis of the deep femoral and superficial femoral vessels. And Behçet disease affects the veins more than arteries. Lower extremity vein thrombosis is the most frequent manifestation of vascular involvement, followed by vena cava thrombosis, pulmonary artery aneurysms, Budd-Chiari syndrome, peripheral artery aneurysms, also dural sinus thrombosis, and abdominal aorta aneurysm. So this was the role of imaging regarding evaluation of the vessel itself. What about evaluation of the end organ, especially in cases of a small to medium-sized vasculitis? This 12-year-old girl with systemic lupus erythematosus developed acute neurological deficit. We can see here acute infarction in the left MCE territory, exhibiting diffusion restriction and hyperintense on flare sequence. We can see here multiple areas of narrowing in the MCA and anterior cerebral artery and internal carotid artery itself. The imaging findings of vasculitis are non-specific and can be found in other diseases, particularly secondary vasculitis, which can be due to systemic lupus erythematosus, juvenile dermatomyositis, and other connective tissue diseases. So again, imaging features should be interpreted in the proper clinical context. Another case, a 6-year-old girl presented with a stroke. We can see here multiple foci of diffusion restriction. However, the MR angiography was completely normal. This is a case of angiographically negative childhood primary angiitis of the CNS. Another case of 10-year-old boy presented with recurrent stroke and these multiple areas of diffusion restriction. However, the MRA was abnormal, showing narrowing of the MCA and left ACA. Also, another infarction is seen in the left periventricular region. This angiographically positive childhood primary angiitis of CNS. Also, MR vessel wall imaging, we can see here infarction in the left internal capsule. We can see here enhancement of the vessel wall is in the MR post-contrast with vessel wall imaging. Another case of 14-year-old girl with Behçet disease complains of abdominal pain and vomiting. This is a plain X-ray showing plank area in the right iliac fossa and ultrasound showing thickening and edema of the bowel loops in this area. And CT showing again thickening and enhancement of the cecum and terminal iliac in the right iliac fossa with thickening of the peritoneum and fuzziness of head brains. And so this is can be interpreted as terminal ileitis or another cause of inflammation. However, we should know in mind that Behçet disease can develop intestinal Behçet colitis, should be considered in patients who present with abdominal pain, diarrhea, weight loss, and rectal bleeding who are susceptible or at risk of intestinal Behçet disease, and should inflammation can be inflammatory bowel disease and TB, and again show imaging features should be interpreted in the proper clinical context. Another case of 9-year-old girl who presented with nasal congestion, cough, and repeated episodes of chest infection. We can see here the nasal septum is missing. It is in a case of another case, similar case, 5-year-old girl presented with chronic nasal congestion and cough. We can see here a granuloma or nodule in the right lower lobe. This is a case of granulomatosis with polyangiitis. Both cases were granulomatosis with polyangiitis, which previously known as vaginal granulomatosis, is a small to medium-sized vessel vasculitis characterized by granulomatosis inflammation with the wall of an artery or in the prevascular or extravascular area. It commonly affects nose, nasal sinuses, respiratory tract, and kidneys. Another case, 16-year-old boy presenting with chronic cough and nasal congestion. We can see here multiple areas of consolidation, ground glass appearance involving the upper lobe, and this was found to be eosinophilic granulomatosis with polyangiitis, which previously known as Churg-Strauss syndrome. Again, it's necrotizing granulomatosis inflammation that often involves the respiratory tract and predominantly affects small and medium-sized vessels. So these vasculitis can be primary or secondary, can affect small, medium-sized, or large vessels, and my take-home message, imaging has an important role in the diagnosis of vasculitis. Imaging diagnosis is concerned with demonstration of evidence of a small wall inflammation, especially of large and medium-sized arteries, or demonstration of end organ disease, and the final diagnosis of vasculitis should be through multidisciplinary approach as we saw. Thank you very much, and I invite you to participate in our group, Pediatric Radiology Tutorials, if you are interested in imaging of pediatric cases. And I also, I'd like to congratulate our resident, Dr. Muhammad Adel, for his efforts in quality improvement in pediatric imaging protocols. فتفضل يا محمد. Thank you very much.